We will now spend some time looking at the IAR Decision Support tool online. The IAR DST is available online. You do not need a login or a password to use it. Users are able to access the IAR guidance documentation by clicking on this link. You can provide feedback to the department about any element of the IAR, including clinical elements or technology, at any time. In order to begin using the IAR DST, we need to first acknowledge the terms of use. Most important to note is that the IAR DST is not a substitute for clinical judgment. The tool and its related guidance documentation has been developed for use within Australia. You can read more about the terms of use by clicking on this link. Once you have accepted the terms of use, you are able to begin using the IAR DST. You'll notice the recommended level of care sits empty. It will auto-populate once all the domain ratings are entered. To begin, you will need to select the most appropriate developmental age group rating guide. Whilst the IAR uses age to indicate the overall appropriateness of each rating guide, the final decision about the most appropriate rating guide to use should be based on the clinical judgment of the user, considering contextual and developmental factors. Once the domains for the selected developmental age group have loaded, you can begin. You will see that the 4 primary domains sit above the 4 contextual domains. For each domain, you can select the domain ratings by clicking on this drop-down box. It's important to read the rating guide before selecting a rating from the drop-down menu. In the rating guide for each domain, there is an overview of what the domain is focused on, the rating scale, known as our rating points, and the rating descriptors. It's important to select the highest rating where a single descriptor applies. Once you have identified which rating descriptor is relevant to the person, return to the main screen and input your rating in the drop-down box. Only once you've rated all 8 domains will the level of care recommendation be populated. Once the level of care has been populated, it flashes yellow. If you make a change to a rating, sometimes it has no impact on the level of care, so the level of care will not flash yellow again. If, however, you make a change to a rating that does have an impact on the level of care, it will flash yellow to let you know that the level of care recommendation has been updated based on your change of rating. You can then read more about the recommended level of care by clicking on this link, and you will get a description of the care environment and core mental health treatment or intervention services that you might refer the person to. In addition to the core services, other health services that may be required by some people are listed for consideration. Once the level of care has been recommended, you're able to generate a report. This allows you to document your use of the decision support tool, and it allows you to communicate about the outcome with referrers or services around you. You can add the patient's details and unique identifiers. The level of care recommended by the IAR DST is captured and will always be retained in the report. You can also select your practitioner-determined level of care, remembering that you can use clinical judgment to scrutinize the level of care recommended by the IAR DST and choose Make an alternative decision if you wish. In this instance, you will see the level of care updates to align with your practitioner recommendation, but it will note that the DST-derived level of care is different. You can see that your ratings on the domains will have been captured in the report, and you're able to add any practitioner notes that are relevant to your use of the IAR DST. You are then able to print. And from that print function, you can save a PDF and upload it to your patient's medical record.